Doctor, you've said the next 10 years could be a turnaround decade for dementia research in terms of the way we deliver treatment, prevention, and the ability to diagnose earlier. What makes you so confident that we're at that turning point now?
I don't have a crystal ball, but there's a lot of room for optimism. First of all, as I've talked about, the diagnostic tests, these have just exploded over the past 20 years. Our ability to diagnose has far outstripped our ability to treat. So now that we have actual blood tests, this will make the diagnosis, precision diagnosis, accessible in a way it's never been possible before. It's not easy to get a PET scan in downtown Toronto. Try going to Northern Ontario and getting a PET scan, or rural areas is almost impossible. Blood tests will make diagnosis and accurate diagnosis much easier. And we're going to need this sort of precision in the diagnosis if we're going to get these drugs to people who will benefit the most. So the explosion of diagnostic tests, not only for amyloid, but for the other protein, tau protein, which is the other major thing we see in the brains of people with Alzheimer's. In addition to the diagnostic test, we have the new disease-modifying medications. So lecanemab is the first, but there's going to be other anti-amyloid drugs and a lot of work going on, drugs to block the tau protein, which may prove to be as important or even more important than amyloid. Drugs to block certain aspects of inflammation we see in the brain, and totally different mechanisms. There are small studies which have been successful showing that drugs where we have stimulate the sigma-1 enzyme, totally unrelated to amyloid and tau, that may have as much benefit as blocking these other proteins. So it may be that there are subgroups of Alzheimer's where one patient, the disease is due to the tau protein, another patient is due to the amyloid. We may need to personalize our treatment. We may need to use combinations of treatment, but all of this is going to be worked out in the next decade. So my prediction is that 10 years from now, we'll have sort of an armamentarium of drugs and be able to target the people who are going to benefit from drug A or drug B or drug A plus B. And so I think we're going to see real advances, and we're going to see advances in prevention. We now understand risk factors for dementia in a way we simply didn't 20 years ago. We're learning more, and there's some shocking and somewhat scary things becoming evident in the past few years. But we know that lifestyle interventions do make a difference at any age, and we believe that there are probably medications you can add to the lifestyle interventions that will lower your risk, mitigate your risk as an individual of getting dementia. So for better prevention, we're going to see within 10 years, better treatment and really precision diagnosis. So together, I think this is going to be the transformational decade that we're going to have.
It is fascinating, Doctor, because obviously the numbers are climbing, right? According to the Alzheimer's Society of Canada, I believe there are close to 800,000 people in the country right now living with dementia, and that number is expected to climb, I believe, to close to 1 million by 2030. Obviously, all these advances we're making are hugely important, but why are the numbers climbing, I guess, Doctor? And is the healthcare system and the society in general ready for that kind of growth?
Well, absolutely not. And the numbers you have are quite correct. There are going to be lots of people with dementia, and if you include the people with prodromal Alzheimer's who don't yet meet criteria for dementia, it's going to be over 1 million very shortly. Look, our healthcare system could do with a lot better planning. You would think that the governments are planning carefully on how to deal with the chronic diseases of old people, but they're really not. And the fact that people don't have family doctors, we've been relying so much on emergencies for what the family doctors should be doing. And the last thing you want is for older patients with chronic diseases to be ending up in emergency. It's been calculated that with respect to dementia, we have fewer specialists looking after patients with dementia in Canada per capita than any other G7 country. We have fewer MRI scans, and they're used much more than in other countries. We're short of MRIs. We're short of diagnostic equipment. We're short of personnel. We're short of people. And the system is not geared to look after older people in a pay a fee for service system, a family doctor doesn't like having an older patient with multiple chronic illnesses because they take a lot of time. And so we haven't developed the nurse practitioners and the clinics, the family practice clinics. There is a network in Canada, but in some areas of Canada, like Quebec, they're really pushing development of family practice memory specialists. In other parts of the country, they haven't even started thinking about it. So we're not in good shape for dealing with this tsunami of dementia, which is really coming. And of course, Canada is province by province. So what's being planned in one province may be totally different if you go to a different province. And this does reflect another shortcoming of our medical system, that we haven't done the proper planning to plan how to care for people. And maybe now that there are treatments, that's going to kickstart pressure on the government to really look at the big picture and get organized.